Hello, welcome to Addressing the COVID-19 Crisis, our weekly webinar series for pharmacists. I'm Michael Hogue, President of the American Pharmacists Association and Dean and Professor of Loma Linda University in Loma Linda, California. Today, joining you from Mobile, Alabama. We are so excited today to be offering a webinar that is not only our typical webinar, but also one that's a treat for all of you, offering continuing education, discussing the recommendations for the upcoming influenza season and the implications of the COVID-19 pandemic on flu vaccination by pharmacists. It's going to be a great webinar with tons of information, and we have the top experts in the field on vaccines and especially influenza vaccines with us today. We are joined by two very distinguished people. First of all, we will have Steve Foster. Dr. Foster has been the APhA liaison to the ACIP since 2001. He's retired as a captain from the United States Public Health Service, and he has personally trained thousands of pharmacists as immunizers. He's also a retired professor from the University of Tennessee College of Pharmacy, but he continues to do consulting work there in the area of vaccines. So we're really glad to have Dr. Foster with us. We're also very happy to have Dr. Olivia Kinney with us. She's a manager of clinical program development at Kroger Health, and she designs the preventative health programs and currently serves as a member at large on the New Practitioner Network Advisory Committee for APhA. After she completed her community pharmacy residency, she became a patient care coordinator at Kroger with a focus on management, pharmacist training, and implementation of clinical services in one of the districts for 18 pharmacies. And so she's going to be speaking to us about those experiences with Kroger. So that's going to be a great treat today to talk about implementation. And as always, we're joined this week by our APhA experts on staff. Dr. Dan Zlot is Senior Vice President of Education and Business Development for APhA. And a little later on in the program, he'll be sharing some information about educational programming that APhA is launching to meet Department of Health and Human Services requirements and some upcoming focus on immunizations. We're also joined by Dr. Elisa Bernstein, who is our Senior Vice President of Pharmacy Practice and Government Affairs at APhA. Dr. Bernstein comes to us after a 30-year career with the Food and Drug Administration, and there has been a lot going on in regulatory affairs in the last several months as COVID has unfolded, and today is no difference. We'll be sharing late-breaking news from HHS with you later on in the program today. Now, let's take just a moment. You're going to be able to respond on your screen and test your knowledge up front. The time to begin your routine flu vaccination program for this year is when? As soon as it arrives to your practice site, July or August, after August, but no later than October, or after October to maximize late season response. We're just going to have you respond here. We'll not really discuss answers. We're just going to discuss those at the end, but we'll see where you're at now. Okay, let's proceed to the next question. Person who presents for the flu vaccination and has an active case of COVID-19 should be advised to do what? Should this person not receive a flu vaccine? Should they get the flu vaccine immediately? Should they be referred to a physician, or should you delay vaccination until the patient's no longer acutely ill? What do you think? It's the topic we'll discuss with our speakers today. Okay, let's move on to the third question. Which of the following does not describe a strategy to safely provide vaccines during a pandemic? Moving pharmacy waiting area chairs to encourage social distancing, leveraging digital solutions like online consent forms and VISs, storing reusable PPE with other belongings, or separating pens and clipboards after use for sanitation. Which one is not a strategy for safe taking care of patients safely? All right, let's move on to the next question, the fourth pre-question. I think this is our last one. Which of the following, the Centers for Disease Control and Prevention, ACIP, is who? Is ACIP a group of health experts who enroll volunteers in trials? Are they health experts who develop vaccine recommendations? Are they health experts who work with the WHO to develop global recommendations? Are they government officials who decide how vaccines will be disseminated? So who is the ACIP? Important to know they're getting referenced an awful lot in HHS rules and regulations these days, so very important. All right, let's move on. We'll cover the answers to all of those today after we're finished with just a few quick instructions here. We're going to do some interviews with Dr. Foster and Dr. Kenny and take your questions. I'll point out to you that in the GoToWebinar control panel, you'll see the question box. As you have questions, please go ahead and type those in. If you have a question on your mind now, we'd encourage you to go ahead and submit the question now. Type it in. We've got a large audience today, and we anticipate lots of questions. So even if your question may be answered during the discussion, go ahead and enter your question so we can get you in the queue. And if the speakers don't talk about your question during their comments, we will call on you and ask you to speak. For those of you who are on computer audio, you will just simply, at the time we unmute your line, you'll just simply need to make sure your microphone icon turns green. And for those of you who are on a cell phone or a landline phone, be sure to enter your audio pin now so that when we unmute your line, you can speak. If for some reason you do not want to talk online to the audience and you'd like for me to ask your question, just say no audio and I will ask your question for you as we go through the Q&A period. And lastly, there's a handouts tab. The handout for today's program is live. We have more slides in the program today than we're actually going to go over because we have some reference materials for you that we want you to have access to afterwards. You can download the handouts from the handouts tab, or you can access it at pharmacists.com in the COVID-19 resources. Those links that are available in the slides are active links, and you can just click on those. It'll take you directly to the resource where the link is. And so hopefully you'll find that that's very helpful to you as we go along. Lots of references that we're going to provide for you today. Well, I'm going to ask Dr. Foster and Dr. Kenny, would you activate your webcams, please? And we're going to get started. We're going to start with Dr. Foster. I'm having both of them join us at the same time, however, because we may get questions along the way from the audience and go off script a bit. So appreciate your flexibility. Dr. Foster, Dr. Kenny, thank you for being with us.
Thank you.
We're excited to be here.
Good, good. Well, Dr. Foster, let's get right to it. There's an awful lot of information that has been going around. Let's talk about CDC's predictions this year in terms of vaccine effectiveness and the overall burden of the flu season. I think we may have a couple of slides here. There's a lot of people who say that, should I really worry about getting a flu shot? It doesn't seem to be too effective. Comment, what are we looking at here? What is this efficacy slide or effectiveness slide?
First of all, I'd like to thank you all for the honor of being invited for this. It's quite an honor. And also to let the audience know that the amount of work that you and the staff put behind to put this together is incredible. So again, we appreciate what you've done. I've watched quite a few of them and they're excellent productions. So I'm afraid we might lose Dr. Hogue here to the movie industry since he moved to California and right there at Hollywood there. But again, thank you. As you know, CDC cannot predict what's going to happen with the flu. In fact, if you and I could come up with a way to predict that, we would not be doing this kind of stuff at the moment. We'd be making lots of money. However, we do know that it changes every year. My favorite saying is, if you've seen one flu season, you've seen one flu season. And if you look across this chart here, you can see that there is some variation that occurs. Now, I will say that 2018-2019 was an estimate. They've actually redone that estimate where it's about 39% effective at the time. So when anybody talks to me about this, I sit there and I go, well, what kind of effectiveness is it that you really want? What do you think that would be needed? When you think about protecting 40% of the people, when you have roughly 300 million people that you could vaccinate, I mean, that's a lot of people to predict. One of the things that we can't predict, though, so much is what's going to happen with this next year, because we base a lot of what's going on in the Southern Hemisphere. they've had very little flu in the Southern Hemisphere this year. They started off with type B again, mostly the type B Victoria, but realistically, with their social distancing, they've not seen and improved hygiene techniques. They've not really seen much flu. They're still seeing a lot of the severe, the acute respiratory infections there, probably COVID, but they're not seeing flu. So what we're going to see, we just really don't know. The next slide, though, does show that we do make a difference. You can see here that this is just the estimates that 39% prevented. And I'm not going to read all these here throughout the time. And then on the right, it's the averages over the last few years. So we're making a difference, and it does prevent a lot of illness.
Steve, I think that it's really important to look at this because especially hospitalizations, when people say, well, the overall effectiveness of flu vaccine was only 39% last year, but that 39% prevented over 500,000 hospitalizations due to flu. That is a huge number. That's really not an insignificant number. So even though the flu may not be complete, the flu vaccine may not be completely effective at preventing primary influenza illness, it does prevent other things. Am I interpreting that right? Yeah, and so and the number of deaths prevented, medical visits, and so forth. There's just so many things that are huge impacts. Now let's move on.
One more thing. The other impact that goes along with this, though, is that we want to make sure that we don't pile the flu burden on top of the COVID burden. So by getting as many people vaccinated as we can this year. And the last thing I'd like to say to everybody is that make sure that you read the influenza ACIP recommendations in detail. These are the best way to get the information that you need.
And I think a little later on in the program, under our resources, we've given our listeners the link to the current ACIP influenza resources and the current recommendations from ACIP. And I would emphasize that it's important for everybody to read that. Now, tell us about the vaccine this year. What changes should pharmacists be aware of relative to the vaccine? It seems to me like it may have changed pretty substantially.
Well, it has. In fact, we've based on last year's, and not so much this year's flu, but last year's flu, they changed the components of the virus. The virus mutated quite a bit, and you can see here they changed 3 of the 4 components for a quadrivalent vaccine. And for the first time, they put up a different antigen for the vaccine that was in the cell or the recombinant-based influenza, because it seems to have a different reaction than the egg-based antigen C viruses that they give people. So quite a bit of changes from in this aspect of it.
So not to get too technical here, but maybe the reason because the cell or recombinant-based vaccines are a little bit different is because they're more precise. They're actually a replica of the exact DNA, whereas the egg-based vaccines are not. Is that correct?
Correct.
Yeah, and I don't remember in 25 years of doing this ever seeing all 3 of the core components of the vaccine change in a single year. This is pretty unprecedented. There must have been a lot of change last year.
Yeah, and again, why we can't say, was it the pressure from the COVID? We don't know.
Yeah. Okay, well, we've already gotten one question in our question box today, and I'll ask it here. Should pharmacists vaccinate a person who has had suspected or confirmed COVID? And for the staff, I've gone a little out of order, I think, on the slides, but I'm really, we're already getting questions about this from our audience. If someone comes in and they are showing signs and symptoms of COVID, or maybe they've had COVID confirmed, do they get a flu vaccine?
If you're using the word past tense, yes. In other words, if they've already had the COVID, if they're over it, yes. If someone's coming in actively sick, the CDC is not recommending that, and they don't give a vaccine at that time. And the reason is because we have no experience with it. There's, again, very little circulating in the Southern Hemisphere. We were kind of watching to see what would happen with that. If you gave the vaccine during illness. And the CDC really makes their recommendations based upon clinical experience and science. So we have no science on that. So the recommendations really are to delay the vaccination. until the patient is over the acute illness, but definitely give them a vaccine if they are not sick at the time. And make sure that
I think one of the other things too for our listeners to recommend is, or to remember, is that that COVID-19 sometimes can cause residual long-term respiratory effects beyond just the acute illness. So remembering to recall those patients back and get them immunized with the flu vaccine seems to me would be important.
And also not to forget the other vaccines that they may be behind in right now too.
Right, absolutely. That's important that we need to do that. Well, let's go back to timing and when is the best time to get the flu vaccine? Probably this is the most controversial subject in all of the flu vaccination world is when do I give flu shots?
I have read the section on timing out of the influenza recommendations at least 5 times, and it is confusing because it changes every year, and they don't change a lot of their meat of the article, but they change how they word it, and so it becomes a little bit more confusing. Right now is the time to start vaccinating your patient if you haven't. Vaccination, and these are quotes exactly out of that. I've tried to cut a few pieces out. Vaccination recommended to be offered by the end of October. Now, while we're past the July and August point, they did make a point in this year saying because of the possibility of suboptimal immunity by the end of the flu season, do not give the vaccine in July and August, particularly among the older adults. And so delaying it until at least September, October would exactly help to spin. Now, the science behind actually this particular statement is weak. Okay, they've got a little bit of evidence. They know the titers fall off, but they really don't know what the protection is, even if the titers fall off. So it's weak, but it's the best that we have. And so again, this was pushed out in the flu recommendations, and I think it's really important that we as pharmacists follow the ACIP recommendations and this. I know there was quite a few programs that started a lot earlier. And it's okay, like, for example, if you've got a child that needs 2 vaccines under the age of 8, go ahead and start it as early as you can. But actually, the balance to this is that if you've got somebody that comes in earlier that you don't think will come back, yes, you want to make sure that you vaccinate them. The fear was that you would skip some of these people. But if you do give it early, keep in mind that there is no revaccination recommended for later in the season, so you don't do it twice.
Well, and I think Steve and Olivia, you both would probably agree on this, that pharmacists are part of an immunization neighborhood. We're part of a community of people who immunize. We're not the only ones immunizing against the flu. And when pharmacists are giving flu vaccine too early, then it calls into question whether or not we're paying attention to the CDC and ACIP's recommendations. And so, if we want to be seen as co-equal partners with our colleagues in medicine and nursing and public health, we've got to follow the CDC guidelines, and that's what you've covered with us here, Steve. So we appreciate that. Okay, I am. Well, let me just real quickly. There's several vaccines on the market. We've got, I think, a table here that shows all of them. Quite a few different quite a few changes in those, and we'll have staff pull those up. What's the key message with all of these products, Steve?
All I did was take the complicated table in the flu things and I simplified it. So I just wanted to have a reference here that people could have where they could see that you need to pay attention to the age indications and the dose indications. Just to point out a couple things, the pediatric, which we may get involved in pretty soon, that some of those doses have changed. Almost everything now is a quadrivalent, with the exception of there is a Fluad trivalent still out there this year, but they also have a quadrivalent. So that we've finally gotten to that point. It's taken us so many years to get quadrivalent. So that's the good part. But just pay attention to the age indications.
Yeah. So, and also I just point out that there's a little bit of a difference here in at least one of the products in terms of the dose, and we've always reminded pharmacists to not try to memorize doses for vaccines, to always verify and validate that you've got the right dose for the product that you're using.
Correct. And as you can see here, finally they got the high dose in the quad, and it took a larger volume to do it, so you can see an increase in dose there.
So Olivia, without sharing any trade secrets from Kroger necessarily, I mean, when you look at a table like this with all of these products that are available, I'm sure that Kroger has perhaps a method for the way that you approach this. I mean, do you normally stock multiple different brands, and you know, how do you kind of go about that from a practice management standpoint?
Absolutely. I think the first thing that we look at is making sure that we pick not too many products, but enough products that we can cover any patient who we could vaccinate and come into our stores. And since we're in over 30 states, sometimes the vaccine protocol ages differ. And so some products are available in certain states and not in others, even though they all roll up to the big company of Kroger.
Yeah. And so you look at these age indications then, and that's a key decision-making factor in which products that you choose to give.
Absolutely.
Okay. And Steve, I just want to ask you in terms of CDC's recommendations with the intranasal flu vaccine, do we have to be worried about giving a nasal flu vaccine during COVID? Are there any special concerns, or are we clear to give that vaccine just like we normally would?
It's clear to give it like you normally would. The main key is watch out if you're using antivirals against the patient, assuming they may have a flu or something. So there's some recommendation with spacing on the antiviral medication, but there's no issues at all with that that's been brought out anyway.
Yeah. Okay. And then the other thing, just a question, Olivia, this might be a little early on in the presentation to talk about this, but what about demand? I mean, we're what, a week or so into September, so we're kind of now getting into the time frame when it is good to start immunizing against flu. Have you seen strong interest in flu vaccine? Is the interest the same as normal, or would you say that there's more interest in flu vaccine?
So far, we are seeing increased demand. And as you mentioned, it's only a couple weeks into the flu season. And so compared to last year, we are seeing a huge influx of patients that are coming in to get their vaccine right now. Year over year, that demand has really increased. And the supply has increased, of course, as well, too, with what's been created and available for us to order this year. So far, it's matching up, and we're prepared to handle that demand.
Okay, that's great. And I think we learned from Australia, actually, that their flu vaccine demand was through the roof. It was the highest demand they'd ever had for flu vaccine because of the fears of co-infection with COVID and the possible complication of diagnosis. It's unclear which infection you actually have without doing testing. Isn't that correct?
Exactly. And
Yeah,
we're seeing so many. Go ahead.
No, you go ahead.
I was just going to add, we're seeing quite a lot of anecdotal experiences coming up of patients who want to get their flu shot right now before there's confusion about what type of disease they may have been infected with. And so there's a whole lot of proactive patients who are willing to come in early and saying, let's get it done.
Yeah, I think that's probably a pretty wise train of thought right now about trying to reduce the complicating factors in making decisions. Just as a side note here, as you think about patients who normally come in during flu season and ask for symptomatic treatment, how's that going to change at Kroger? How do you suggest that change? We've been telling people who are symptomatic to stay home and call to have assessment of symptoms first and to determine what to do. How are you dealing with that in the pharmacy, where people used to just come in and get OTC flu treatments and now they may not do that? What do you do?
Exactly as you stated, we're trying to employ a lot of telephonic consultations and really encouraging patients to call in and speak with us first. We have a lot of contact lists, appointments that are available, and we'll get to that in a couple slides to talk about different ways that we're encouraging patients to speak with us electronically first before coming into the store and possibly being infected by other people or bringing that into our staff who are located in the store.
Now, I know that Kroger does COVID testing. Does Kroger also do flu testing?
In certain states where the scope of practice allows for that, we have been rolling that out. One of our biggest uptakes is in Michigan in particular.
So, just to dive into that a little deeper, if someone were to call and were to have flu-like symptoms during flu season, would you test them for both flu and COVID, or would you only test them for COVID, or what would be your approach there in Michigan, for example, in a state where pharmacists can do both?
That's a really good question. Part of that depends also on what type of COVID product that we're getting and being able to roll that out. At this time, we've been taking it really slow and cautious when it comes to testing symptomatic patients, really encouraging them not to come in. We do have quite a few little clinics as well. There are over 200 of those, and so they are in some ways better equipped to handle patients who have symptoms to be able to test them for which test they would need.
Now, the hottest topic, I think, since we started these webinars some 20 some odd weeks ago, and the hottest question we get is about personal protective equipment. You've noted here on your slide that PPE supply comes with a lead time, and that's a key learning. Tell us a little bit more about that.
Right. And as you mentioned, this is a hot topic. We are always on top of this, but PPE, just as a rule, seems to take a while for it to get to us. And so we've been really trying to be on top of that, to order what we anticipate we'll need and even a little more than that, to make sure that we are handling that and able to provide it to all of our staff. I'll talk about this again in a couple slides, but really the biggest commitment is that all of them can feel safe to be able to provide patient care with the appropriate PPE that's recommended by all of these governing bodies.
And I would just remind everyone that the CDC does have on their website specific guidance for adult immunization providers and pediatric immunization providers in terms of PPE that you should use during immunization experiences. And so I would guide you there. I think we've got reference to that later on in the program. Now, you've got a couple of pictures here for us that we can take a look at. Are you doing appointment-only flu vaccines, or are you going to accept walk-ups?
We have been committed to accepting walk-ups, but strongly encouraging appointments. And so these pictures that you can see right here is when you're first walking into a store, we of course have floor markers and plexiglass barriers. These are a bunch of strategies that we've put in pictures here that maybe you can take back to your practice site and apply. And also, if you've grocery shopped in a store right now, you've probably seen a lot of these. Something to make sure to notice too is the social distance waiting room and spreading out the chairs, so that way it's not an option. We're not just programmed to naturally sit in a chair, but to make sure that it's spaced accordingly. And then if you go to the next slide, it will answer your question about how we're handling appointments versus walk-ups. If you've seen quick response codes or QR codes before, they take you through your smartphone. You can scan this code right now as you're watching this, and it will take you to the website that promotes appointments. And it also has a contactless consent form process. So ideally, a patient has scheduled an appointment before coming to the store with us. But if you walk in and want one, there are QR codes there that you can scan as well and fill that out. So it's limiting the amount of clipboards and pens and just more things that are touched and possibly could be spreading germs in our stores.
Yeah, and for our listeners who may not be as tech savvy or have the support of a corporate technology team, QR code programs are pretty easy to access online and to link back to a website where you have forms and so forth available. So they're pretty easy technology to use, Olivia, don't you think?
Absolutely. And the CDC has also provided VIS forms through QR codes as well that can be used to, again, limit the amount of paperwork.
Absolutely. So getting as much of the paperwork done in advance prior to people coming in will reduce linger time inside the pharmacy and will ensure that you have a safe experience for both the patient and for the pharmacy staff. So it sounds like that's really the right move to make in that regard. Now, are there any other workflow considerations that we ought to know or that pharmacists ought to know about in terms of the way you're handling flu vaccinations during this season?
Sure. One of the first things that comes to mind is that even though we have these different digital strategies, that doesn't replace a pharmacist being able to review what the patient has presented with. And so filling out those consent forms before it comes to the pharmacy and then reviewing it in advance is key. Because if you notice something, maybe the patient has some symptoms, then we can call them and stop them ahead of time from coming in, or maybe it's not time for them to get their flu vaccine, as we just discussed previously. So making sure that even though we have all these other strategies available, we're still using our brains and thinking through if this vaccine is appropriate for this patient.
And I think we've got a picture of the PPE that you're using for your pharmacists. I think that's on the next slide. You're using face shields, and what else do we have there?
Sure. These are just little tangible things that you can take back into your pharmacy as well. One of the most important things is that for the reusable PPE, making sure that it's stored in an appropriate area. I know that pharmacies can be small, lots of hours are, but dedicating a spot that's away from your personal belongings, that way you don't actually transfer anything unintended. And then on the right side, there's a picture right here of a place that you can dispose masks if you are in that as well. So just being thoughtful about how we store and dispose of things appropriately is key.
Yeah, well, I want to just ask one more question, then we're going to start taking questions from the audience. What is Kroger planning to do to address hesitancy that patients may have in receiving flu vaccine? I think there's some statistics the CDC has put out there that there's at least a third of patients who don't plan to get a flu vaccine this season. And so there is some hesitancy out there. We also have hesitancy with COVID vaccine, but speaking specifically of flu, how are you addressing hesitancy? I think just some thoughts there from you would be helpful.
Sure. We've been looking at hesitancy from both a patient perspective and a provider perspective. With patients, a lot of times it is an opportunity for us to educate them on the safe way that we are providing vaccines, and also ensuring them that we're following the guidance and when it is appropriate to receive a vaccine. Also, as always, with permission, sharing facts and personal experiences, finding why it's important for them to be able to be protected as well as their loved ones is important. For our providers, we saw more hesitancy in the beginning of the pandemic, where we were not sure how to provide this preventive face-to-face care, but making sure that we could protect our people, provide adequate PPE, and protect them and care for them through like emergency leave guidelines, found that it really limited hesitancy. They felt garbed up appropriately, ready to go and to provide this care to their patients.
Okay, well, we've got questions from our audience coming in, just tons and tons of questions. I want to get to as many of them as I can. We're going to have the staff unmute the line of Anthony Ball. Anthony Ball, you have a question about a governor's recommendation. Let's hear your question. Okay, well, I'm going to ask your question for you. What if the governor of a Western state recommends getting the flu shot in mid-August because it may run out? So in other words, concerns about not enough flu vaccine to go around this year. Steve, tell us about supply.
Well, the CDC has actually ordered extra supply this year. Our typical amount that they were going to make was about 177 million doses, which was more than adequate for what we've seen in the past. CDC has ordered about an extra 10 million doses on top of that, so that we for the manufacturers to produce. So we really should not run out, because as you mentioned before, there's still a third of the people saying they don't want it. So we're hoping, but again, the point of it is that duration of protection is what we're concerned about, not running out.
Well, and speaking about taking the vaccine, one of the things I've been personally very proud of is that for the last 4 or 5 years running, pharmacists have one of the highest rates of flu vaccination among all the health professions. I can't remember the exact number, Steve, but we were either highest or second highest, if I remember right.
Yeah, we've fluctuated back and forth, yes.
Yeah, so just remember, we need to go first and lead by example. Pharmacists, technicians, and pharmacy students, let's make sure we get our flu vaccine. It's time. And I know when I get back home, I plan to receive my flu vaccine right away. So I hope everybody else listening today will do the same. All right, let's take a question here from Youngjun Choi. Youngjun Choi, CHOI. We will attempt to unmute your line and let you ask your question about flu vaccines. All right, we're not hearing you. We may be having an audio problem. Let me ask this question also, Steve, this one's for you. When should we decide to give the live flu vaccine versus the non-live flu vaccine? So in other words, the intranasal vaccine versus the inactivated vaccine. Is there a decision-making process that pharmacists need to consider?
Well, you have to keep in mind the age ranges because it is only approved for age 2 to 49. And also, in the younger kids, make sure they don't have any concurrent lung disease for those asthma, that type of thing. So, but I would say that really is a decision with the parents. Most of the parents can help you make that decision for them. I think that it's you could tell them that we have both available. What would your preference be? But I don't think there's no advantage of one over the other that I'm aware of right now.
Okay. And we've got a question. I'm going to ask Dan Zlot to also join us on screen here, or I'm not sure if you're audio only or video, Dan, but Cynthia Lett has asked the question, are the cloth masks, which many people currently use, protective enough from nasal sneezing of a COVID-19 positive person, as the virus has a 3-hour duration in a sneeze? So are cloth masks effective? If you know somebody's COVID positive, should they be wearing a cloth mask, and should they be coming in your pharmacy?
So that's a great question. So the answer is probably we really don't know whether cloth masks are effective. When you look at the data and you look at the fluid dynamics, and I will qualify this by saying I am not a fluid dynamics engineer. Fluid dynamics also describes heavily how small particulates travel through air. So that's why that's applicable. But in theory, a cloth mask would help cut down a lot of those very, very fine particulates. It would catch many of those. So you'd have less of that entering the air. Now, is a cloth mask sufficient to protect you or protect people around someone who is known to be COVID-19 positive? The answer is we really don't know, and I would highly discourage people who are COVID-19 positive from going into pharmacies, even wearing cloth masks. So if you know someone is COVID-19 positive, it's probably best if your store has that policy to turn them away and ask them to return once they've cleared their infection.
Yeah, just remind everybody that CDC has pretty clear guidance on isolation, self-isolation of COVID-19 positive individuals and the time frame to do that. And so I'd refer you back to CDC again. They're the experts on this and have some pretty detailed recommendations. Now I'm going to ask the staff to unmute the line of Jonathan Cuevas. I apologize if I mispronounce your name. Jonathan, we're unmuting your line.
All right. My question is, has there been any talks about drive-through flu clinics at your pharmacies at Kroger?
Yeah, Olivia, how about that? Great question. What about drive-through clinics?
Absolutely. We 100% are behind drive-through clinics. We are starting some in over 19 different regions this upcoming week. We have some flu shot centers where we're going to be able to service a ton of different patients as they come through to get their flu shot. If you are looking to do this, though, one of my big things is making sure what type of car your patient comes through with, right? If they're in a big old SUV, like get up on a step stool, make sure that we're administering appropriately and think through some of the more tactical guidance. But anytime that we can stay outside and make sure that our patients and staff are protected with some of those engineering controls that are natural, I think it's worth it.
All right, that's great. And I've heard of a lot of drive-through clinics, so I think that those are definitely a mechanism that's being utilized and even mentioned, I think, in the CDC guidance. Now, we've got two questions from two different persons that are very similar, Steve, and I'm going to guide these to you. The first question is basically asking about what data supports asking older patients to wait until later for getting their flu vaccine because of waning. As you mentioned, I think briefly, that the data has not been terribly strong on waning. And then a similar question is, okay, should we just wait until October to give our high-risk immunosuppressed and elderly patients the flu vaccine? Is there any clarity you can give us on, number one, is there data to support a decision on the delay? And then secondly, what about our highest risk patients? Should we just delay? Both of these have to do with waning.
There is data available. Most of the data is based upon immunological levels. Okay, what are the titers like when they fall off? How fast do they fall off? There's evidence that they fall off within 3 months. There's evidence that they fall off within 6 months, because there are multiple studies that have looked at that. But that doesn't really apply to what really happens to a patient. Do they have more cellular protection from that point? In fact, Dan might be the one to answer some of that question. But the evidence is there, but it's really varied and difficult to interpret. I hate to say this kind of stuff, but you know what? I'm not getting my flu vaccine until October, and I'm in the elderly group, so I'm going to wait to make sure that I get the titers the best I can. But that's not a good way to do it. What you want to make sure, though, is that you don't miss opportunities, because if you got patients that you don't think are going to come back, you definitely don't want to wait to do that. One of the fears of the delay, and it was written in that thing, was that up to 15% of there could be 15% more cases of flu if you have the opportunity, you don't give it, and they don't come back. So that could be huge.
One other complicating factor that I've observed is that when we shut down in the spring due to COVID-19, there was a lot of fear in people's minds about being in public, and there still exists a tremendous amount of fear in a pretty good subset of the population about being in public, period, even now that things are starting to reopen. If we were to see a significant resurgence of COVID-19 in the fall, many of the people who might have been circulating around and being willing to come to your pharmacy may now not be willing at all to get out because they're scared of COVID, and they might not get a flu shot. And so that's kind of plays into the complex.
Yes. If we get a peak again, if we had something to say that the incidence of cases peak, people are going to back off from going out. So I agree with you.
Yeah, well, we've got dozens and dozens of questions here, and I can't get to all of them. I'm so sorry, but we are going to let Kaylin Bowman ask the last question for our live Q&A segment. Kaylin Bowman, your line should be unmuted now, and we'll let you ask your question.
Yes, my question is, with all the changes and the demand for immunizations in the retail pharmacy setting where I work, it has we're accommodating, we're using all the CDC recommendations, but the time and efforts are not caught up yet with hours and support. And I find that hand washing, changing gloves, cleaning rooms, donning extra, protection measures takes more time. And I'm getting very bombarded by meeting everybody's expectations, from patients to calls from the doctors. And I'm wondering, when is that going to catch up, and what support is there going to be from top down, from either state or federal guidance?
Yeah, so Kaylin, you've asked a great question. We're going to let Olivia take a stab at this initially, but there's definitely a need to ensure that community-based pharmacies have adequate staffing to deal with all of these new immunization requirements. Olivia, give your perspectives from Kroger on this.
You nailed it. It is unprecedented right now how many additional tasks are being asked of all of our pharmacists and technicians. And so we believe in supporting them and ensuring that appropriate staffing is there, and also make sure that our technicians and interns can practice at the top of their license, so they can lean in and vaccinate where appropriate and help relieve the burden that can be on pharmacists, so we can all work together to make things run smoothly and still ensure that preventive care is provided to our patients.
Yeah, absolutely. And I'll say that also in response to this question, that APhA strongly supports pharmacists in this, and we are actively engaged in advocacy efforts with all of the major chains to ensure that they understand that pharmacists must have adequate staffing to provide good patient care, safe patient care. And so we encourage all chain pharmacy organizations, all employers of all types, to ensure that they're providing adequate staffing for pharmacists to provide flu vaccine during COVID season, COVID vaccine when it comes, as well as all the pediatric immunizations and adult immunizations we're being asked to do. Well, Steve Foster, Olivia Kenny, thank you so much for joining us for today. I appreciate you being here. Thank you so much.
My pleasure.
Yep.
All right, now we're going to invite Lisa Bernstein to join us. Lisa's going to share some news that we have out of the Department of Health and Human Services this week. Lisa?
Hi. Yeah, yesterday, thanks a lot, Michael. Yesterday, you probably heard the shouts of hurrah and joy that came from pharmacists across the country. We were expecting and waiting for HHS to make a major announcement, and they did. And what they announced was that they were authorizing pharmacists to order and administer, and interns to administer, pharmacy interns, COVID-19 vaccines that have been authorized or licensed by FDA to all individuals age 3 and older. And this was very exciting. What this does is similar to authority that was given for testing and for childhood vaccines a couple weeks ago. This new authority is under the PrEP Act, which actually preempts state and local laws that serve as barriers for implementing this requirement, which means that if it overrides any scope of practice, laws or requirements in your state. So there are a number of conditions that are associated with this, including certain types of training, record keeping requirements, and other elements of information. But we'll be providing more information in the future, very near future, about implementation. But this was extremely exciting. So this basically says and that the government and HHS and the administration recognizes that pharmacists are key access points for the delivery of COVID vaccine throughout the United States. Let's go to the next slide. And related to that, and I hope all of you have seen our Pharmacist Guide to Coronavirus. And just a few weeks ago, we updated the web pages. And one of the elements is our immunization information. And I really urge you to go there, click on the immunization button, and there's a host of information that provides you with resources and CE for immunization. And I want to particularly direct your attention to one. If you can see under providing immunizations, there's some new resources that were posted yesterday that includes a template for pharmacists as a condition for that HHS provided for administering childhood vaccines as well as COVID. Pharmacists are required for patients that are under 18 to talk with the patient and the caregiver about the importance of a well child visit. And we have worked with other NASPA and NCPA to develop a template that pharmacists can use to talk with that patient and provide information that can be transmitted to the patient's caregiver or doctor. So go to that website. There's some really good information there. You want to go to the next slide. And the next slide is, if you are familiar and have been on our webinars before, you know that I show this slide every day to go to our web page to take action now. We still need your help. We have over 30,000 letters were sent in this effort for pharmacists to contact your legislators, and we have this web page that's set up, and the website is here. All you have to do is fill in your name and your address. It pre-populates a letter that you can send, or you can customize it to tell your legislators how important it is for them to include pharmacist provider status for COVID testing and flu immunization. So please go to that website and take action now. And finally, we just posted a new web page, really excited to share, that provides information for you to advocate on behalf of yourself and on other pharmacists at the state, local, and federal level on COVID priorities. And this includes testing, immunization, pandemic response. A lot of the authorities that we've been given by CMS and the government are only for the pendency of the public health emergency. But we can do this. We don't need to do we don't have to limit immunization and testing to just the public health emergency. So this website provides you with some resources and talking points on how you can advocate for the profession and join in those efforts. So I highly encourage you to go to this website, take a look around, look at the video, and if you have any questions, contact the APhA government affairs staff. And I think that's it. I'm going to turn it back to you, Michael. Thank you.
Thank you, Lisa. Well, we've got several CE opportunities coming up for you, and I want to make you aware of them. We've got a catch up and keep up with immunizations in the era of COVID-19 that's happening next Tuesday. You can register for that at pharmacists.com, and also the psychological impact of COVID-19 on patients and their providers that happens Wednesday, September the 16th. Both of those register here links are active in the handouts page, and so we encourage you to register. In addition to that, on the next slide, I'll just point out that there is a new CE coming soon on pediatric immunizations. This is a 2-hour refresher for pharmacists, available for both members and non-members for a small charge, but this will help you to be compliant with HHS's rules about 2 hours of immunization CE during your state licensing requirement. It's not 2 hours specific necessarily to pediatrics, but we know several pharmacists have been very interested in brushing up on their pediatric immunization knowledge, and so hopefully you'll find this very helpful. Our next slide, please. And we're always wanting to make sure that we have opportunities to engage with you and for you to engage with each other, and that's why we have the Engage platform at APhA for you to be able to ask questions, and we will post the answers to some of the questions that we didn't get to in today's webinar on the Engage platform so that you'll have the opportunity to learn even more about today's topic. Next week, we'll do this again at the same time and same place, Thursday, September 17th from 1 to 2 p.m. Now, I think we're going to test your knowledge and see what you've learned today. Our first question, recognizing that ACIP changes their flu recommendations every year, when should you begin your flu vaccine program? So the question here was, as soon as the vaccine arrives at your practice site, July and August to protect for possible early season, after August, but no later than October, or after October to maximize late season response. What is your thoughts on this? Okay, looks like most of you have already answered, so let's look at the results here. The results of the poll, well, 83% of you answered correctly that after August, but no later than October is ideal for most beginning your routine influenza vaccination program. So make sure you're immunizing actively. And of course, we're going to continue to give flu vaccine for as long as you have it in stock and available in your pharmacy and until the end of flu season. Next question. Person who presents for flu vaccination has an active case of COVID should be advised to do what? Should they get the flu vaccine now? Should they get it later? Should they be delayed, deferred, or should they not get a flu vaccine at all? What are your thoughts on this? Let's see. Oh, we've already got a huge response rate. Let's go ahead and see what the results are. Delay vaccination until the patient is no longer actively ill. That's exactly right. And remember, another comment about this that we didn't discuss during the webinar, but if a person has been hospitalized for COVID-19 and they're going to be discharged, the CDC's general recommendation for inactivated vaccines is that if a patient is well enough to be discharged home, then they are well enough to immunize with inactivated vaccines. And that would be an appropriate time for those of you who are hospital pharmacists to administer a flu shot at discharge and before the time that they get home. Next question. Which of the following does not describe a strategy to safely provide vaccines during a pandemic? Now, this is one of those not questions that we in academia love to ask. Which one is not a good strategy for safe vaccination? So we've got folks answering quickly. I appreciate that. Everybody's got time to click on the buttons here. And I think let's see what our results are here. 100% of you got it correct. That's storing reusable PPE with other personal belongings is not a very good thing to do, not a very safe strategy. So make sure you designate a good location for storing reusable PPE so that it can be appropriately cleaned. Next slide, please. The last question. The CDC's ACIP is who? Who are the ACIP? They've been in the news a lot lately, lots of work groups and the ACIP working on a lot of different things related to vaccines. And you've heard them mentioned because pharmacists have prescriptive authority to administer vaccines now for pediatrics and COVID-19. And so we have to follow ACIP guidelines. We're getting good response. All right, let's see what the results are here. And that's right, health experts who develop vaccine recommendations in the U.S. So the ACIP's recommendations are for U.S. vaccination through the entire lifespan. So that's great. All right, thank you everyone for joining us. We've had a great informational session today. I know I've learned a lot and I'm sure all of you can say the same. If we didn't get to your questions today, we apologize. We will do our best on the Engage platform for COVID-19 community. We will attempt to answer as many of those questions as we can. Thank you for joining us. We appreciate all that you do for your communities. Good luck and God bless.